Another episode of Health Talks with Dr. Trinh. The one show, maybe the only show that helps you make sense out of the noise and figure out how to get your own health on track with the man who's always on track but not always on time, Dr. Trinh. Welcome, sir.
That should be my logo, my tagline: on track but not on time.
On track but not on time here. That's what we're going to say is the new motto here. So welcome everybody to another episode. Today we're going to talk about wellness. We're going to talk about how to get everybody well. And that's where we're really going to head with this thing here today. So why don't you bring in your guest and tell us more about who's going to help us get well here today?
Yes. Hey, good morning, guys. On Facebook, I see Sunshine's on. John Gutierrez of OC Hospice is on. And I have my good friend Penny Foskaris, our Greek goddess, is on today.
That's going to be her tagline. We found out she's Greek, so now she's
we just
a
found
Greek
out she's
guy.
Greek, so she's like, Greek. And so she is the founder of Foskaris Wellness Center, located in Anaheim, right?
Yeah.
Yeah, and so both Penny and I really love wellness and prevention, and the non-medical side where you got to pop pills.
Is that what it is?
I wanted to bring Penny on today just to kind of share.
I thought the medical side is popping pills. That's what I always think of. The medical side is all about popping pills here. You got a problem, we'll give you a pill for it here.
Exactly. That's why we're bringing on the wellness side.
Before you do that, is it, well, maybe Penny can answer this. Do doctors welcome wellness, or does it just put them out of business here? Because modern medicine, Western medicine, is based on the idea you get sick, you go pay somebody to fix you. You don't pay somebody to prevent you from getting sick.
Well, I'll tell you with weight loss, the doctors just say go lose weight, right? Eat less or find something to do. They don't have any tools. So it's not like they say, here, take a pill, because actually you have to have your BMI has to be a certain point where actually before they even give you a pill, which is not really good for you.
And what's BMI? We got to stop you every time you use an acronym here. BMI is?
It's your body metrics.
Body metrics. Okay. All right. So the doctors just say, go do it, but they don't have any, because doctors don't seem to, did they spend a lot of time talking about nutrition and wellness, Dr. Trinh, or did that one class you take in 3 years?
Nutrition and wellness, we have like, on average throughout the whole country, and a survey has been done on this, the average primary care doctor spends about 7 minutes with their patient. And in that 7 minutes with your patient, we are busy reviewing their labs, reviewing their consult notes, writing prescriptions, refilling prescriptions, putting in referrals, and addressing the primary reason why the patient is there, along with a list of whatever questions they have. So where does prevention and wellness even come into the discussion?
Yeah, right.
Unfortunately, it doesn't, because by the time you're done or you're barely done talking about or reviewing and writing prescriptions, the next patient is already waiting for you.
Yeah, right.
Wellness does not exist, unfortunately, because there's no time or room or space with it.
Well, and is there, I don't want to sound awful here, but is there an economic incentive to discuss wellness? If you stay well, I'm not going to see you. But if you're constantly sick, then I'm going to constantly have a flow of patients.
Yes, there is that business model that's been around forever, where you get paid because you write in a diagnosis.
Yeah, right.
Right, and a diagnosis means there's an illness, and you don't get paid unless that diagnosis is in there. And so yes, there is that fee-for-service business model where you're incentivized to treat sickness as opposed to prevent illness.
Now, having said that, there are more and more, what would you call them, health nets Kaiser, Blue Cross, whatnot, and they're trying to find ways to reduce the number of doctor visits because doctors are expensive. You train for a million years. Maybe we don't need to see a doctor for everything. Maybe there's ways we can. They have physician's assistants now that treat you for less urgent things, and maybe there's some ways we can limit the number of visits or limit your return to the hospital after you've been in there or whatnot. They seem to be open more to trying to do more preventative stuff because they recognize the cost benefit to them.
So for example, obesity, right? 2 out of 3 Americans have a body mass index that is in the category of being overweight or obese. 2 out of 3 of us in America.
Wow.
And so what do I tell a patient who's in front of me who is overweight? I just tell them, you're overweight, exercise and eat good, and see me back in a year.
Yeah.
That's it.
Right.
And I just assume something's going to happen in that year when nothing may happen. So I want to hear what is really needed in that, and this is why I brought Penny in to because I think she fills that gap that many of us physicians do not.
Yeah. Right. You just say go do something, and then it's up to us to figure out how to do it.
Right. I'll tell you with the body mass index too, BMI, it only takes the weight and the height into consideration. It cannot see inside the body whether it's muscle, fat, or water. And so I have clients that come in sometimes and their BMI is not even that high. Again, it's just the height and the weight. And we look inside and do a body composition analysis with our bioimpedance device, which can see and separate everything. And the body fat percentage might even be at 45%, which is really, really high, or 50%. And they're not even aware of it. And the doctors say, you're fine, you're healthy, because on the BMI chart, they aren't that high because muscle weighs more than fat. And so when their higher composition of fat is high, the muscle's lower, you cannot even see the ratio unless you do a body composition analysis. And so people are walking around and they're not even sure how healthy or unhealthy they are. We also can see if there's visceral fat around the organs, which is the dangerous fat. So we have the subcutaneous fat, which you can pinch. And then we have the visceral, which is around the organs, which you can't see. And so when we come in here, the first thing I do is put someone on the body composition analysis machine. We use the InBody 570, and it calculates all of that. They can also see the visceral fat. And I will tell you, 85% at least of the people that come in here are under eating. And they're like,
they're under eating. You're going so fast here. Under eating. Most people I thought were overeating.
No, they might overconsume at a meal, but a lot of times they come in. I have a lot of busy professionals, a lot of nurses, a lot of radiologists, just different people that come in, and they're so busy they don't have time to eat. Okay, or they're working at home and they say, you know what, when I was in my office, now with COVID-19, I'm at home and I'm working straight and I forget to eat. And they're eating 1 or 2 times a day. And what happens is their body's like, hey, where's my food? You want your brain to work, right? But if you don't feed it the food, and they don't realize it, so when we do it, we get a report that comes up here, and we can also see their basal metabolic rate. That is what they need to consume just to stay where they're at. They stayed in bed all day long and did nothing. That's what you need. That's your minimum consumption of calories.
Now, my wife is she's a big, she's grew up in the world of dieting, and she always thinks eating less is always better. And she's trained her body to go on very little food, and she's pretty little, and she maintains her weight that way. But I always say, she'll say like, well, you didn't do anything today, you don't need to eat anything today, you were just sitting at home.
Well, like here, this person here needs 1,750 calories just to be where they're at and stay alive. And I will tell you, this gentleman came in on August 17th, 62 years old, and we weighed him, and he was 213 pounds. And the next week he came in, I did one session on fat melting. We'll talk about that later. But he came in and he lost 5 pounds and he was so happy. And I kind of burst his bubble because when we looked it's in the metrics, he had lost 4.9 pounds of water, lost over 2 pounds of muscle, and actually gained 0.2 pounds of fat.
He
And we start
gained
seeing,
fat, so all he was losing was the illusion of water and whatnot. Yeah.
correct. And so when I see this, and I see this 16 times a day, I'm looking at these reports at least. And when I looked at that, I knew that he wasn't eating enough. And so everybody keeps a notebook in here. And I looked inside his papers, and I'm like, he had 3 small tiny meals that equaled 750 calories. His basal metabolic rate was 1750, and he's starving himself. And what happens is your body is smarter than us. Look, when our car runs out of gas, it pulls over. I mean, that's, you can't do anything, right?
Right.
But our body's like, hey, you don't need your muscle, so I'm going to take away your muscle. And even if you eat chicken and broccoli and not enough food, I'm going to store any little bit I can for fat, because I need to make sure that your body's functioning properly. Your eyes, your nerves, your hands, your eyes, everything needs fuel, nutrients. And so when he added 2 extra meals and added some more vegetables and things, and he brought his consumption up, he actually lost almost a pound of fat in 4 days, and everything got more balanced. And I see it all the time. I'll just tell you, I have 2 record holders this past week, which are female, which like, yay, because the guys usually lose weight faster, they say. And both of them, the one that lost 4.9 pounds of fat, and I'll show you what that looks like in a minute, how big of a piece of fat it is. She added 2 extra meals. She was eating twice a day, barely anything. And by eating more, her body was able to release the fat. Okay. But it's
So
not
her
like,
body,
hey, let's go forge at a, I'm sorry.
I'm just I'm trying to get my head around this. So if your body doesn't get enough food, it's gonna eat the muscle first and not the fat. The fats it's storing for later. The nuts it's saving for winter here.
Yeah. Yeah. It's true.
It
Completely.
also depends on what you eat.
Well, that was my next part of the sentence,
Yeah.
was what are you eating? What protein? I mean, a carb can be a carb, but yet what is it, like, the nutrients you're getting? If you overconsume, even if it's beans or oatmeal that's healthy, you can gain weight from that. Okay. So we're looking at ratios, and we can calculate, because we have all of the metrics here, what you need, and we start doing a balanced diet. Okay. People need to have lots of fresh fruits and vegetables, organic, so we can, absorb nutrients, because you really need vitamins and minerals to fuel your body. If you just had sugar all day long, you're gonna be exhausted, because there ain't no nutrients.
Yeah,
in the
right.
sugar.
And that's what we have, sugar all day long here.
Yeah.
All right. So the modern American diet, what's wrong with it? Dr. Trinh keeps saying it's the source of all our inflammations and aggravations and
Sugar diet.
what's wrong with Twinkies and Coke and all this stuff here?
Well, that's not really gonna fuel your body.
Fritos.
We
love
look at
Fritos.
what do we put in our car. I always go back to the car analogy, because everybody's got a car, and if you put really cheap fuel in it, and you don't keep the fluids in there what you need, your car's not going to run properly. And same
Not
with
for
the
very
body.
long. It's not. Sooner or later, it's going to conk out. Yeah.
Going to conk out, yes. And so when you have too much carbohydrates, it's going to raise your insulin levels as well. And so we really need to look at everything what you're eating, but honestly, is eating more food, but yet the right amount. And we're not talking about eating more pasta, because if you're going to have a serving of pasta and you have a big serving of pasta, you're going to be really exhausted afterwards, and your body's not really getting nutrients much from that. So
The data shows a plant-based diet.
plant-based diet.
We got to get Dr. Trinh a little closer to whatever he's talking into. He's kind of soft there.
Yeah, the data shows a plant-based diet is usually what longevity is associated with when we do longevity research.
And yet
So-
none of us are brought up to be vegetarians. My wife is a vegetarian now, but most of us, and more people are drifting that way, young people especially. But I was brought up meat and potatoes in the Midwest here. That's all you had was meat and potatoes, or some other carbohydrate, bread, meat and bread or whatever here. That was what my mother cooked. That was what all the neighbors ate. That was what we consumed.
Well, if we're going to have animal protein, it needs to make sure, it's grass-fed. All the antibiotics that are going into these meat. And sometimes people are like, I'm not sure why I'm not feeling good. But if you're allergic to the antibiotic that the cow consumed, you're getting it in. Same with the chickens, right?
Oh.
And even with, with the foods, people say, should I have organic? Well, the pesticide that they put on that carrot or celery, whatever it was, you're ingesting that too. So it's just kind of like whatever we put on our skin. It's the same thing. Whatever's going into the vegetables and fruits, we're going to eat that too. So there's a lot of things that go into the foods, and when you're looking at it and why people might not be feeling good, or we do food sensitivity testing as well, and so we can kind of see what might cause inflammation to the body. But then again, it could be also, where did you get, where's the source of that fruit or vegetable? Who grew it, and what did they put on it?
Well, how do I know? I just went to the store and bought it here. It just said fresh.
Yeah. I will tell you, let's see, it was 2018. I was doing my cooking segments across the US, and I went to the store. I want to show people what it was when something's oxidized. Okay.
Okay.
And I bought an apple and I cut it from the night before because I wanted to show what oxidation was. And because when you eat like fried foods that are commercially fried and the oil's used over and over, it becomes oxidized, and it's really not healthy for your body. It's a carcinogen now. And so I cut this apple. I didn't buy organic because I wanted to, I just thought it'd be fine. I mean, so I cut the apple.
Right.
The next morning it was still white. It didn't turn brown. And if the air cannot break down,
that's the miracle of modern food science here. The food, you can leave it out for days. It doesn't rot. That's what's good. We want to just leave it out. But if air
can break it down, neither can your body to absorb the nutrients. And that's what happens. And so we need to look at too, when you actually buy organic, sometimes they still use some certain chemicals that are deemed organic and safe, right? And so I really tell my clients, test your fruits and vegetables. Cut up that apple. How fast does it turn brown? I mean, when I was growing up, I'm 52 now. I mean, in the 70s and 80s, you cut up an apple, you're like, within 5 minutes, you better eat that thing or it's brown.
Yeah.
Right?
Right.
Not anymore.
No, I remember years ago I owned a bar. This is a strange story. And so I got to go to Budweiser, to the factory where they make the beer. And whether you think Bud was a good beer or not, it's not. But whether you think it is a good beer or not, they put so many preservatives into that beer that you could leave it on the moon for a year and it probably wouldn't change. I mean, it's designed to stay fresh in the store under a variety of different circumstances, heat, cold, whatever, in, out, or whatever. It just has so many preservatives. It is preserved forever here. And I thought that can't be good for you.
Yeah.
We have some Facebook questions here on
Okay.
Facebook. John Gutierrez from OC Hospice says, I eat about 4 to 5 meals a day. I eat 3 major meals and in between smaller nutrients. I drink lots of water because I walk 10,000 to 15,000 steps a day.
Wow.
I cut out all the sodas and junk food and lost 30 pounds in about 90 days.
Wow. Just from getting rid of the junk food and sodas and stuff.
Yes. He says, now I eat a bit more because I notice I get more hungry. So I do eat more of old pasta and carbs, but very minimum. Portion control is key, right? With a question mark.
Absolutely. And I tell you, when I hear people starting to get hungry, that means their metabolism just turned on again. That's one thing that happens is, for many years, it could have been years ago, that your body would say, hey, I need food. And you're like, I'm too busy. I want to lose weight. Leave me alone.
Right.
And then the body says, fine, I won't tell you when you're hungry. And so I, recommend starting with even just a couple bites of something. Have a couple bites of apple if you're not hungry. Get the body going, because if you're not eating enough, of course, I have clients that overconsume, but I can show them. And going to a restaurant, you're like, what are the calories? What am I eating? But you can start looking, now that all the menus are online, it makes it really super easy to decide what are you going to eat before you go to the restaurant. So instead of getting tempted, and oh my God, there's chicken wings, yay! And there's
so what is more important, the total calories, the kind of food, carbohydrates and sugar, the amount that you consume? Everybody's got a different theory. Some people cut down the amount. Some people cut out calories. Some people cut out certain types of foods like carbohydrate. I've heard all these different diets and all these different theories. Is there one answer, or is it all of them combined?
It's a combination. Each person is different as well. We're dealing with different blood types, and you can tell. I mean, people do their blood type and like, I'm an A. No wonder I don't eat. I have a hard time with digesting, red meat, and they're okay with fish.
You're telling me the different. I've never heard this before. Different blood types. How many different blood types are there, Dr. Trinh? What, 3 or 4?
Well, there's more. Well, it goes into A negatives and B. There's a lot of different,
A, B, O. I got the cool blood type.
What's that?
I don't know. I just made it up.
Oh, okay. I was going to say I want to have the cool blood type. You know what? I'm 64. I don't even know what my blood type is.
Most people don't, if you donate blood, they have it on your card. But at the hospital, they can do such a quick test. If you needed blood, they just know within a few seconds. Is that correct, Dr. Trinh? They can see quickly if they need to give you blood.
My blood type is, I actually had to check because I was in the Marines and you got to know your blood type and all that for transfusions. My blood type is A positive. Do you know why that is?
No.
Because if it was A negative, my parents would beat me up unless I got a good grade. It had to be A positive.
Everything had to be A plus. You couldn't be
A minus. Is an Asian F, right? Asian F. So my blood type had to be A positive.
Had to be A positive. You had no choice. Okay.
Pretty much.
Yeah.
That's awesome.
I don't know what my blood type is. How could I find out what my blood type is other than going to a doctor and asking for a test?
There is some of the health food stores have the kits and you can do it right there. They're a little difficult, but blood tests, of course, they can do it. Most, don't do it unless they need to have it done, but you could ask for it to be done.
So it sounds like I should know my blood type because you're telling me different types of blood, A, B, O, all these different things, have different metabolism, have different rates of absorbing food. The blood in me has something to do with it.
It's chemistry. And just like I do my food sensitivity testing with the Zytoscan, and it can actually send a frequency with different foods to see how the body reacts to it.
You threw that out so fast. I have no idea. I saw your lips moving. I didn't know anything that you just said. You said a Zuby scan or something, and you test and zip and zap, and there, poof.
I get excited. I'm so sorry. I get excited. So we do a food sensitivity test with the Zytoscan, which you put your hand on the cradle, and it actually sends a signal through your body to see which foods are better for you and which ones you stay away from. And they're really, they coincide very closely with the blood type diet as well, too.
A Zytoscan. Dr. Trinh, do you have a Zytoscan in your office? I've never, and no doctor has ever said, hey, come on over. And they tell me to step on the scale, but they never say, let's put your hand on the Zytoscan.
We do a blood test called an immunocap that looks at your body's food sensitivities. So in the doctor's office, it's a blood test, and we can tell if you're allergic to gluten sensitivity or if you're allergic to certain foods or fish or nuts. So it can be checked through a blood test as well. Yeah, I'm not familiar with the Zytoscan.
So what is a little device, and somehow it sends some little pulse or wave through your?
Yeah. So what it is you put your hand on the scanning device. It's connected to the computer, which the software is held in Utah, basically the company. And what it is they actually, even if it's like a medicine, it's the same thing as someone holding it and doing muscle testing, okay, to see how your body reacts and see if you have like a weakness when it hits your body. And so it takes about 7 minutes. It goes over 400 foods. And I do that particular test because I was very sick about 15 years ago. And I went from doctor to doctor and no one could figure out what was wrong with me. I had a hard time driving my kids to school. I was dizzy. I'm like, oh my God, I'm gaining weight. I got to get to the gym. So I'd walk like a robot because I was dizzy to hold on to something to try to work out.
Yeah.
I had major intestinal issues. I had pain. It felt like somebody was stabbing me every single day. And I had really bad indigestion. And I just sat there for, I think it was about 3.5 years I suffered. And no one could figure out. I was doing all kinds of tests, different doctors. And one day, I'll just tell you, I was sitting on the ground and I was praying to God that help me just be normal. I just want to be normal. I didn't want to feel great, but just normal and have my normal life back again. And 2 days later, actually, I made a promise that I would help as many people as I can at that moment. If I get the opportunity
Don't
to do
ever bargain with God because he may call you on that, right? Exactly.
I'm telling you, it's a blessing to be in my office every day because I get to help people see through a lot of barriers. And so 2 days later, a friend of mine who was an RN told me about a place in Redlands, I live nearby there, who had the food sensitivity testing, the same one with the Zyto scan. And when they tested me, my top 3 foods not to eat were black tea, bananas, and strawberries, which sound pretty good. For me, it's like poison to my body. I was eating strawberries every day in my protein shake, trying to do something good.
Yeah, strawberries.
And
What's
when
wrong
I
with
cut out the
strawberries?
strawberries, my intestinal issues went away. When I cut out the bananas, I mean, I would try to go for a walk. My kid's like, oh, there's mom. She slowed down again. And I'd be in the store and have to sit there just dazed, not knowing what's going on. And I cut out the bananas and it helped me not be dizzy anymore. And when I cut out the black tea, which I had switched to black tea from coffee because the study said have black tea instead of coffee back then. And once I cut out the black tea, all my indigestion went away. And so those were 3 foods. And so
Now, how did you but how did you discover it? You were just experimenting, or did somebody
I went to a
advise
place
you?
who had the same test in Redlands where I used to live, and they did my test, and that's what they discovered. And it was the 3 foods I was eating. And I cut those out, and all that went away. And sometimes it's the food. I had one of my clients who, it was carrots, was bothering her stomach. She had stomach issues for about 1.5 years. And when we tested it was carrots. Another one, it was coffee. And
Carrots. I never heard of any carrot allergies. So we can be
it's a
allergic to
sensitivity,
anything.
not an allergy.
Yeah. Well, kind of this Dr. Trinh always says the same thing. If your body reacts to it, it's inflaming somehow here.
Yeah.
All right. So somebody wanted to know, before we go too much deeper here, somebody wants to know, how do they get in touch with the Foskaris Wellness Center here in Orange County?
Well, you can go to foskariswellness.com, or you could give us a call at the office, which is 714-340-0038.
And what city are you in?
And we're in Anaheim Hills.
Anaheim Hills. All right. So before we go any deeper into this, you got to tell us the ugly facts now here. How do we pay for this? This is all out of our pocket because the health companies,
Yes.
the medical insurance isn't going to pay for any of this, or do they?
No, they don't. And even like some of the services that are offered, even at doctors' offices, they won't cover that. Unfortunately, this is not, they're not covered. But we do have, I will offer your listeners 20% off my services.
20% off. There you go, folks. They just
20%
mentioned
off.
Dr. Trinh, right? Exactly.
Yep. Friends of Dr. Trins, whoever's listening, 20% off our regular price services.
And what's the typical process? Do I go see you once a week, once a year, once a month, whenever I feel bad? Whatever.
Come one time. If we're doing fat melting, which we melt fat, which
you melt fat. Okay.
I melt fat. Yes, I do.
You
It's
show
so.
us.
I'm gonna plug my computer in because it's about to die here. Sorry.
All right.
Plug this in.
You can melt fat.
we
Boy,
use
isn't that the dream of everybody? I don't want to work it
It's
off.
so
I just want to
amazing.
melt it.
So, we wrap you with infrared and red lights, and it liquefies the fat in the cell. I show you this. This is actually fun because actually was it in August? I got the opportunity to be on a Zoom call with Dr. Oz, and I showed him my example that when we put red lights, which I have a red light here, actually is a real.
We got to get
red
Dr.
light
Oz
here.
on here too. We got to get
Dr. Oz, yes, I got to do on a Zoom, and his eyes popped out when I did this. So it's funny, but when the red light hits the fat cell, it becomes more liquefied and permeable, and the fat can start coming out. And so after 20 minutes, the fat starts coming out of the cell like this.
Oh.
Okay.
Ooh.
So, ew. And it goes out, and the cell stays open for up to 48 hours. So we eat a low carbohydrate meal, and then we need compression to keep the fat out of the cell and keep it out.
Yeah. So
And-
how do you compress? Do I just keep pushing it?
With like a neoprene belt or Spanx, something that compression wear.
Spanx. I get my Spanx on here. Right.
Compression wear.
Do you ever wear
That's good.
Spanx, Dr. Trinh? Do you ever put your Spanx on in the middle of the day
Yeah.
here?
That doesn't sound
So
very
compression
good.
wear, neoprene belt. The men get the stomach, women the thighs, the buttock area, the arms. We can wrap different parts of the body, and it's really amazing. And you feel great.
No.
It
So
helps
Your
the body,
entire
actually.
body. So certain areas of your body is wrapped, and then there's red infrared light, just kind of penetrating those areas, right?
Yes, it's able to penetrate into that, and we do see even the visceral fat level going down every 2 or 3 times somebody comes in. So it's getting the subcutaneous, and also helping getting rid of the visceral fat, which is the fat around the organs.
What's visceral fat? That's the fat around the organ. That's the one that's
Yes,
hard to
the
get rid
dangerous
of.
fat.
Right.
And that's something you can measure. You have the device to measure that in the
Yes, we do. Yep. So we come in, as long as they're level below 20, we can see on the report the visceral fat level. And so it's amazing. So when we go through it and we're like, oh my gosh, it dropped, everybody's excited because that's hard to get rid of, the fat around there. You can't surgically remove it.
Yeah, no, because it's wrapped around your stomach. It's wrapped around your organs. It's constraining them.
And
yeah.
yeah, and I'll tell you, it's like, even especially like men sometimes don't have a lot of subcutaneous fat. It's underneath the muscle. There's nothing they can do, and this will penetrate beyond that. So it's pretty.
Now,
it's pretty
when
amazing.
it melts it or it makes it, and then you compress it, and it's squishing out like in your example, then what do I do with it? How do I flush
So
this
what
stuff
happens
out?
is it comes out of the cell, okay, and it goes in through the lymphatic system to process through the liver, just like a fatty meal, and they use that for energy. That's why we don't have carbohydrates for the 2 days, so we can utilize what the fat that's being released for energy.
You burn that instead of the carbohydrates.
It's probably better to exercise right after that. As soon as you know the fat's coming out, then it's time to go work out.
And we do, and I do encourage. So we get on a vibrational plate machine for 10 minutes to start.
You get on a what?
I have to slow down. Sorry, a vibrational plate machine. I'll walk you guys around the office in just a minute. I can show you.
Vibrational plate machine. You got one of those in your office too, Dr. Trinh? Here, you don't have a what was the scanner? What was the name of the
Zyto?
Zyto scanner. You got to get one of those.
I'm vibrating on my own.
So you shake for 10 minutes. It's like equal to exercising, but I do encourage my clients the day we do and the day after to do as much walking and exercise as possible, because you will burn more fat. And so the process in the office, we always do the body composition analysis first.
Right.
Then so we can see, did you move? The new clients, we do our measurements, not with a tape measure, but we actually have a device that takes a picture, and the software measures to a computer pixel the difference in your body. Okay, so you can see the difference.
Okay.
And because we want to be accurate.
So you're measuring this, then you might be testing me for food allergies, and then this other thing is somehow you shake me, and does that really work? That doesn't sound like that would really get me. That's like the old they would put the little thing around your belly and it would shake and.
Well, it's getting the fat out away from the area, from the cell, because we want to get it burned off as fast as possible. And after that, we put you in the infrared sauna, which helps again with circulation to move the fat out. So my clients stay in there about 20 minutes afterwards. That's the whole process in here. We give you a nice cup of detox tea as well. So it's a relaxation. We have relaxation glasses that we put on when you're laying there for 20 minutes to melt your fat. We have these wonderful relaxation glasses that have colorized music from Belgium. So
colorized music. What the heck is color? I can't see music. Music isn't a color.
It has. I want to hear. So this here.
Dr. Trinh, what are we talking about here? Are you buying all this? Come on, this is crazy stuff here.
Dr. Trin's done these, right? Isn't it amazing? So these are on. We put them on, and this has color. Okay. Oh, this one's dead. Okay, I can't show you. It has color here. And then you have the music, and so it coincides with the music, and every 20, 30 seconds, the color changes, and it's so wonderful. People finally get to relax. You know, a lot of times if we're stressed, we can't, even if you're not doing something, but you still have things in your mind, you can't release them, you won't lose weight. And so this is a whole body transformation when you're in here, slowing you down, relaxing, releasing fat, and it truly works. I mean, I have usually 1 to 2 pounds of fat released each time someone comes in. Record holders 4.9 and 4.8 pounds of fat just gone in one session. I have people who can't put their pants up past their hips, and 3 days later they can pull them up past their hips and button them. Okay.
So how often again would I come? What should I budget in for this thing? Do I come once and just magically melt a few pounds? Do I come back weekly, annually, monthly? What do you?
So most of my clients come once or twice a week. We don't do it more than twice a week because it takes about 3 days to see the actual results fully. We want you to make sure that we're getting it. And the cell stays open for up to 48 hours, so we don't want to redo it the next day because you're wasting your money. So
Right.
we don't want to do that.
Okay.
And so it's once or twice a week. The first time someone comes in, it's only $59 for a single area, which you could lose what you need to. I have people who just have a little bit and then it's gone. And, you know, compared to like freezing it, which could be $600 for an area this big,
Right.
I can wrap the whole body for about $350 and you're getting everything done. And that's where we see the big things. But usually on average, about for just a single area to continue, it's about $150 each time you come in, which you're covering a whole big area, whole stomach. We go all the way for the men, all the way to the top of the chest. We want to make sure we get the visceral fat all the way to the bottom of the belly. It's really,
So
you know,
that could add up. You're talking about
$150,
$150, you know, twice a week. That could be $200-$300 a week or something if you really wanted to go full bore into this.
Yeah, and they might just need 6 times. But if someone did cool sculpting or freezing fat, to say,
right.
like I had one client who went in just to he did triceps and the bra area, and it was $3,000.
Oh my goodness,
Okay.
just to freeze it and do all that. Yeah.
Yeah, it's a lot more expensive than people think. So one stomach, one time, which will take off about 20% off of the area, is about $4,800. Okay.
To freeze
so compared
it?
to that,
Right. That's in your method or in the freezing method?
no, that's the freezing.
Right.
And if someone did surgery, that could be $3,000, but then they could have scarring
Right.
as well, and it's not safe, you know.
And so what would comparatively your process cost roughly to do that same
So
thing?
if somebody came in maybe 6 times, which I've had people lose 5 pounds of fat, which is a lot in 6 times. That's actually, they lose more than that. That would probably, with an area, set them back maybe $800.
Okay. All right. So much more cost effective to do this. Now, all right, the key question. This sounds outside of medical science. Do doctors embrace this, or do they, if I went to my doctor, would he poo-poo this?
You know, they don't really know much about it. And I'll tell you, I now invested in machines that show the actual results. And so I'm actually putting all my case studies together to present to the doctors, because they say, oh, it doesn't work, but no one has really shown the data. Like, I can't change this report. Okay.
Right.
I can't change what you were measured on the computer. And so when somebody's measuring, most people that do what I do measure with a tape measure.
Right.
And it's hard to get. I mean, I was between offices. I was helping a doctor in Marietta, and I was like, oh my gosh, her arm is bigger afterwards, but I can't tell her that. I know it's not bigger, but you can't get the tape right. And I thought, there's got to be another way. And so we used to have one that would measure you, spin you around, but that one, if someone breathed, it wasn't accurate. This one is, we put you front, back, and it measures to the computer pixel. So there really is no error. And now I have data to show the doctors, to show them how amazing and how people feel great.
Why wouldn't medical groups, though, embrace this? Because it would be another service they could sell, and it would be another thing patients are looking for, rather than the doctor just saying, go fix this, call me later sometime. It'd be another way they could continue the health and make some money and all those good things. Yeah.
Well, I think because the data hasn't been there yet. No one's taken the time to invest in the machines that I did to show the data. So that's where the difference, because if you tell a doctor, hey, look at my measurements, and you write them down, you could write down whatever you want.
Right.
Okay.
Right.
And they get them on a scale, and it might have a small, showing the body fat percentage and how young they are on the inside. But then again, they handwrite everything down. So when you have with the data, now I can say, hey, take a look. And here's my before and after pictures. Here's the measurements. And so I'm on a mission actually to get these out to more places, because I am on a mission to reverse type 2 diabetes and obesity in this world. And I cannot do it by myself.
No,
okay.
Clearly not. Because that's the Western curse right here, is diabetes and sugar and all that kind of stuff.
They go hand in hand.
So how did you learn about this? Is there a school of thought that you belong to, a school that you went and trained? Are you self-taught? How do I find others like you?
So the nutrition part, years of studying and getting, certification in nutrition, and also with the fat melting, I had to, do a little bit of course that, not very much, but there's a little bit to learn with that. But I learned after a friend of mine had purchased the machine in Marietta, and I said, this is not going to work. And so I wrapped myself. and it worked. And I said, holy moly. And so I've been here at this office a year in March, and I have a huge drawer full of case studies to show what the results are because I have hard data. And so now I'm getting ready to actually try to present it to doctors and show them how they can have their clients feel much better, lose the weight safely, effectively, and they feel amazing. Along with pairing up with these, which relaxes the mind. There's a lot of stress in the world right now with jobs and everything.
So
COVID.
what do you think, Dr. Trinh? You're a trained medical physician, but you sometimes go outside the world of the constraints of the medical science here. You're open to research and other sorts of things. If you went and talked to your other doctor friends, would they say, come on, have you lost your mind? Or would they say, no, yeah, I think that makes sense?
It's really showing the data, and the data is being collected.
Can't hear you.
We got to get you to speak up again here. You're talking real stuff.
So can you hear me better now?
A little bit, yeah, right.
Yeah, so it's really about showing the data that is objective, and the data is being collected right now. I've seen a number of published articles on using red light, right, for health reasons. It's science that is emerging. This is all emerging medical science, and so Penny is at the leading edge of looking at all this science. Obviously, there aren't randomized studies on these devices with thousands of patients, but there are actually studies using these devices out there. Although smaller studies, but the studies do show adequate results, and of course Penny is measuring and collecting and compiling that data in her own patients right now.
Are there others doing this too? There must be others with this machine or with this technology to them. And how do I separate the good ones from the bad ones? Because I'm assuming that in this world of something new, there, like nutrition itself, there are charlatans and fakes and phonies out there, or people that are pushing bad science as opposed to people who are doing good science.
So there are other people that do have red light devices similar to what I have. But there's some of them that say, hey, check out my new food that I got in the box, right? So they want to sell you box food as well. They're not really looking at the metrics, or they're measuring and they're not really seeing, did the person lose fat, water, muscle? Because even if I melt fat and you're starving yourself, it's not going to work. Like the gentleman who came in, lost 5 pounds on the scale, he was ecstatic. But when I looked beyond it, I was able to start changing his metabolism so we can get fat off really fast. And so that's where the difference is you might see the fat go away from the area, but where did it go? Did it actually come out of the body? I can release it. Your body's starving. It's going to go, I'm going to hold on to it. Right. It's kind of like the car runs out of gas. It's not smart enough to take from your transmission fluid, but your body knows the difference. It says, hey, you've got muscle. I'm going to take that and you can release this fat, but I'm not going to let go of it. And you could go run for 10 hours, or I could try to melt it off of you. If you're not eating enough, it's not going to work. So when that happens, this gentleman came in, I don't wrap, I don't charge on that visit. I say, okay, let's go over your notebook and let's see what's going on so we can change it, because I want to help you have the tools after you're done here, getting a few sessions that you can do it on your own.
So you hit one of the key things, and let's talk about this, Dr. Trinh. I've known people, one of my cousins, for example, always suffered being overweight, and she went and had the gastric bypass, this, which seems like a horrendous thing, but that's how desperate she was, and she lost a lot of weight, but she gained it all back. How in the world? Because she hadn't changed the way she consumed food, or what food she ate, I guess, or whatever. And it wasn't that she suddenly binged and ate a bunch of food. Her metabolism put on weight easily, however, I don't know if it's just built into your body. Some people gain weight, some people don't. I don't know if it's in your blood now. I don't know if it's in the type of food you're eating or how often you're eating. But here she went through this severe process and gained it back. And you're saying the same thing. You can come and melt this fat away, and it'll just magically reappear again if you don't change the underlying problem.
Yeah. I'll tell you an example. A client came in June, and she bought a small package, but didn't do it. She decided to go do liposuction.
Right.
And she came back now in August. I mean, what are we at now? So it's September, sorry. So sometime in between she had liposuction. When I did her body composition, her body fat percentage was higher than when she was here in June. And I didn't know she had had surgery yet.
Mm-hmm.
And I thought, okay, COVID, she's been sitting or something's going on. Her food's not right. And when I went to wrap her, I saw the 4 scars on her stomach from where they had done liposuction. I said, did you do liposuction? She said, yeah. And now her stomach is uneven.
Yeah.
Her stomach has 4 scars that will be there for a long, long time if they ever disappear. And because she didn't change, and she was one of the ones who was not eating enough. And the thing is what happened, her body just kept storing fat again, because there's still fat cells there. There's fat cells all over. People start getting lipomas, different parts of their body if you do liposuction. And because you took some of the cells away, if you're not doing something right, your body says, okay, well, where's another fat cell? Just because you took that one away doesn't mean it's not going to come back. And so I'm really changing. I call this, honestly, this is my x-ray to the metabolism.
Mm-hmm.
When someone who's starving themselves, who's afraid to eat because all they hear is eat less, move more.
Right.
They're afraid to eat, but when they see this, they go, oh my God, I mean, I'm not eating and I gained fat. Yikes. And it's very sad. I have one client, she's MD, she's a physician, so is her husband. And I'm like, this is not going to work. You're not eating enough. You're eating 650 calories a day. You need 1,200. And she says, but when I don't eat, my husband says that was very good discipline. And so,
right. Because we've all been taught that fat is just from, you're just weak. You're eating. You're giving into this craving here. Just stop the craving. Stop the control yourself.
Until someone's done this and knows, like this person here, 1770, if he ate that all day, he will not gain weight at all. That's what your body needs. Just, and as soon as just to lay down, as soon as you sat up, you just burn more calories. As soon as you walk, you just burn more calories. And so people are starving themselves and don't even know it. They're just listening to eat less, move more. Right. And until someone has looked inside here and seen what somebody needs, they should not tell someone to eat less.
About eating the right food
and the right thing. Absolutely. That it comes down to that for sure.
Not just about really adding calories. It's about eating the right food.
Yeah.
And
exactly. That's true.
You talked about this when you had that cooking class with one of your clients here, how people skip breakfast, skip meals all the time. I can't tell you the number of people I know that say, I don't eat breakfast. Forget that. I just get up and get going. And I'm like, how do you get going on an empty tank here? How do you get going on skip the dinner more than skip the breakfast? The dinner that you're going to eat 2 hours before you go to sleep. That's the big meal with most Americans.
There's a whole science behind intermittent fasting that makes a lot of sense. But really, a calorie is not just a calorie, right? You can say, because it's important where that calorie came from.
Mm-hmm.
And
completely true.
Really important.
Yes.
You can have a calorie that comes from junk, or you can have a calorie that came from a plant, and they're different.
Well, we're going to have to wrap up here because I got another show starting in a couple minutes. Tell us one more time how to reach the Foskaris Wellness Center in Anaheim Hills.
So you can go to foskariswellness.com. That's FOSKARIS wellness.com, or you can call us at 714-340-0038. Thank you so much.
Well, leave it to Dr. Trinh to find a wellness expert, a fat-burning guru here to bring on the show. I look forward to more wellness talks here at Health Talks with Dr. Trinh.
Thank you.
Yeah.
You've been listening to Health Talks with Dr. Trinh right here in Orange County's only community radio station, octalkradio.net.
CRM was designed for managing relationships. Sales engagement is designed for starting them. Current stats indicate that sales reps only contact new leads about 50% of the time and make less than 2 attempts to contact them. and they're only about 35% productive. CRM is the wrong tool to engage sales prospects. VanillaSoft is an engagement platform. It allows you to rapidly turn marketing qualified leads into sales qualified leads. According to user reviews, VanillaSoft will increase your pipeline and productivity by 3 times or more by ensuring each new sales lead is engaged within seconds persistently and with the cadence that's optimal for your prospects. Don't let your sales leads fall into a black hole. Take your lead engagement and sales qualification out of your CRM. Try VanillaSoft for free at vanillasoft.com.